Okay, we're live now, thank you.
Thank you. Good afternoon, everybody, and welcome to the virtual meeting of the Children and Young People's Social Care Services Scrutiny Panel. I'd like to welcome everybody here this afternoon. We do have some guests and we'll introduce them later on. Or would we like to introduce them now, Jo?
Yes, Chair, we can do that if you'd like to.
Yeah.
At the moment, we have Louise Kelly on behalf of Public Protection, Katrina Jackson on behalf of Public Health, obviously Sue Butcher and Rachel Farnham we know from Children's Services, Stacey Carlisle from Newport Primary School, and Sergeant Stephen Patterson from Cleveland Police.
Right, thank you very much. We'll carry on and welcome everybody, all councillors this afternoon. The meeting is being live streamed via the council YouTube channel, and whilst members of the public can view the meeting, they will not be able to actively participate or comment on proceedings. As the meeting is being live streamed, I would remind all participants that their conduct should reflect this. Normal rules of procedure apply, with any questions or comments directed through myself, the chair. My name is Dorothy Davison, councillor. Have we any apologies for absence, please?
Councillor Marston, Chair.
Thank you. Agenda item number 2, which is declaration of interest. Councillor Halawi and Councillor Walker.
Yes, I'd like to declare two aspects of interest. One is that the locality work takes place in the ward which I represent, Newport Ward, and secondly, I'm co-chair of governors on Newport Primary School, which is also represented here. Thank you.
Thank you, Councillor Halawi. Councillor Walker.
Thank you very much, Chair. Yes, I'd like to declare an interest for Links, the youth project, because I'm chair of that project. Thank you very much.
Thank you. Thank you both for that. Now can we go to agenda item number 3, which is the minutes of our previous meeting held on the 22nd of November. Can we agree these, or is there anything to add to these?
Agreed, Chair.
Agreed,
Thank
Chair.
you. Thank you, Councillor Walker. Have we got a seconder?
I would second that, Chair.
Thank you,
Councillor
Councillor Halawi. I would also like, just before we continue on to the locality working, I'd like to congratulate Sue and all her team on with us being withdrawn from her commission involved with our children's services. I think that's got to go from everybody on this. Thank you, Sue, and your team. Thank you. Locality working. Further, we'd like the background. The panel is currently looking at the topic of locality working from a children's services perspective. We have been provided with information regarding the locality working model, and 2 pilot projects are in Newport and North Ormsby. We've also been provided with specific information regarding children's services, involvement and staff within the project. The panel has heard information regarding various partners working within the locality pilots and agreed we would like to invite some of them, which we have done today, to discuss their involvement in the locality working so that we have a better understanding. So we've introduced the people that are here. I'm going to ask them their involvement in the locality pilot project, how they might work directly with children's service element of the project to achieve better outcomes for the children and their families, and how they feel the locality approach is working from a multi-agency perspective. Now, I would like each of the people that have attended, which are Louise, Katrina, Stacey and Ricky, if he's here now, to give us a quick 5 minutes on your involvement with our locality working. And then I want, as each one of you do this, I will expect the panel will have questions for you. So if we can all agree this, and we'll carry on. And can we start with Louise Kelly, please?
Chair, did we not? Are we going to have some feedback from Adam Parkinson as well, who's joined us now? He's the locality team as well.
Yes, of course, Councillor. We will. As Adam here, yes. Yeah. Okay. Thank you. Right. Thank you. Do we want to start with you then, Adam, please, and then Louise?
Absolutely, Chair. Following on from last scrutiny, so I am the Neighbourhood Development Manager for Middlesbrough Council, and I'm currently leading on the Newport pilot of locality working. So specifically around children's services, in both locality models, we've got allocated resource, named officers from children's services within the model. Have been co-located both virtually and in office settings when COVID has allowed over the course of the pilot. So as part of sort of the children's services aspect, a couple of additional things that we've done throughout the pilot is make sort of children and family specific meetings and working groups around ward specific issues or families with additional need, etc. So we can put that sort of team around the family or individual to look how we can best support people within the wards to get where they need to be or to access additional support, things like that.
Thank you. Has anybody got any questions for Adam, please? No? Yes, Councillor Higgins, would you like to come in, please?
Thank you, Chair. I was just wondering how many staff are allocated to Newport?
Yeah.
How many to North Ormsby?
Can I just come in there? We're actually going to deal with Newport, and we'll be doing North Ormsby at our next meeting. So most of the questions today will relate to Newport.
Right, thank you, Chair.
Thank you. I see Adam's actually disappeared. So we'll move on. Can we move on to Louise, please?
Hi, everyone. Sorry, just in relation to that last question, I don't think there's particular staff sort of committed to the scheme. It's more partner and multi-agency working. So Adam's locality manager, but obviously different services sit within locality. If that answers that question for Adam, seems he's
Thank you.
having trouble. So selective licensing is actually in both areas of locality. So we're in Newport and North Ormsby. As a service, we've always engaged with children's services and worked in an integrated way. I think what locality does, it gives us the opportunity and the framework for that work, and also gives us some, the arena to have some really valuable conversations, especially in the times when you can be in an office, which we recently had. So selective licensing sits under public protection, but some of the things, the ways we get involved is with early help. So quite often early help will come to us if they're working with a family and they're in a property of poor disrepair. They'll bring that to our attention, and then we'll offer joint visits, and we'll get environmental health involved, and we'll go out and inspect the property just to see if it's adequate to live in. We carry out assessments with families to see if they want support, if they need support. So when we go in and do our inspection visits or post-tenancy visits, we have a checklist we go through, and on that checklist we'll always ask if they've got any services working with them or if they require help from any services. So it gives them the opportunity to ask for that help if they feel that they need it. The team attend child in need meetings, child protection meetings, and they feed into support plans. we often speak to social workers just to see if families meet a certain criteria, if they feel that they meet the threshold, or if it's more of a early help referral that we need to do. We share safeguarding concerns. We have access to the LASS system, which gives us information on families so we can see if there are early help or social workers involved, so we can start having those conversations if we're already involved in a family. As I said, we already carry out the housing inspections. So if we find any concerns when we're in there, we'll also raise them with social workers and early help. We then come on from the antisocial behaviour side. So we involve social workers and early help in behaviour contracts if we're putting those together. If we feel a child who is carrying out antisocial behaviour needs a referral, we'll make those referrals into services. And I know we talked about Newport, but the other area that we cover, the neighbourhood safety officer there is having trouble with youth ASB, and she's actually set up a meeting where all the social workers for the children involved attend the meeting fortnightly to discuss the concerns and ways forward with that. And public protection is a wider service, so we've got trade and standards, so they deal with things like age restricted products, so alcohol, cigarette sales, things like that. Yeah, I mean, lots of work we do is out and about in the area, so we do tend to spend a lot of time out of the office. But as I say, once we're in there, it's so easy to have those conversations if partners are in there as well.
Thank you for that, Louise. That's really, really interesting. Anybody have any questions? Councillor Walker?
Thank you very much, Chair. Thank you, Louise. You seem to cover all bases there with working with early help, etc. How do you feel it's working?
I think it's working well. I think it's been testing times. I'll go back to the COVID. Unfortunately, if it was an ideal world and we were in the office, as we should have been, you know, having those conversations daily, I think it would have, you know, would be where we want to be. At the minute, we're doing things differently. We have meetings to discuss the issues, multi-agency meetings, the partners are there. Just before this recent working from home, we had started to see more people coming into the office again, so you could have those conversations. Not a lot to change for us, like I say, because we've always been integrated and we've always been out there. But I do see the value in it as well. Like I say, for those, when you can have those actual conversations with people, it's just a thing when you sat there and you're looking at something and there's somebody next to you and you can just say, oh, what do you think of this? Or I've got this family, how do you feel? You know, we should go forward with this, and you know, it's beneficial just to have that there rather than having to find somebody or phone somebody.
So you can bounce ideas off each other,
Yeah.
which is not always, it's not always easy unless you have a meeting on virtual or a
Yeah.
one-to-one. It can
Exactly.
be very, I would imagine it can be limiting on what you can achieve sometimes. So do you think it's having much of an impact? Would you recommend it for other areas?
Yes, I would recommend it.
Brilliant.
Thank you for that. Is there
Thank you.
anybody else? Have you finished, Councillor Walker? Sorry.
Yes, thank you, Chair. Yes.
Oh,
sorry.
thank you.
Thank you.
Thank you. Right. Anybody else? Any more questions for Louise? Right. Can we move on to Katrina now from Public Health?
Thank you, Chair. Hello, everybody. Yeah, I'm from the South Tees Public Health team, and we have been involved with the locality work since it was sort of created. I know we're looking at Newport today, but we have a member of staff attached to the Newport team and a member of staff attached to the North Ormsby team, who's just been on as a comment, so we're getting a new member of staff to cover that area. So we generally are there to provide the widest public health in its widest sense. So we are there to develop community engagement links, to ensure that the different services involved in the locality teams know that they can come to us if they have any concerns about health and well-being within the localities, signposting, linking them to practical services like drug and alcohol services, but then also some of the softer health and well-being issues like poverty, helping them with fly tipping and that sort of thing, which also damages you know, your mental health and well-being. So all those wider aspects of mental health and well-being, we're there to support and signpost. And that includes making relationships with the communities through joining in on walkabouts and litter picks and getting ourselves known to the street wardens, etc., just to maybe raise awareness about how we can make those improvements to the families involved. I've picked the brains of Coral, who was particularly attached to Newport, and things that she's done on the children and social care agenda hasn't been a huge element for us because it has been handled so well by organisations like Links and things like that. But we've had links with the schools to improve the school environment through our links with Middlesbrough Environment City. They've done work. What else was she up to? Yeah, poverty signposting. We also provide quarterly data through our public health records on child development data and breastfeeding rates in the areas and things like that. So it's after practical support, the data we could provide there, but also we want the teams to know that they can work in partnership with us to learn more about public health and how that impacts on the well-being of those communities. So we're there to share information and have a vice versa relationship with the teams involved in locality working. That's a general overview.
Yeah. Katrina, do you think this is working for you?
I think it is. I think if anything, COVID has probably helped raise the profile of public health and some of the wide range of services that we offer. And we are always keen to join any new approaches where there's real coordination and teamwork and partnership working because it's essential to support families in need. So I think it's helped increase the understanding of public health within those locality teams. I think sometimes there's probably often more work to do, and perhaps some of our partners on the localities perhaps still don't understand the role of public health and the wide breadth of what we can help them with. So that's always something that we're trying to promote even further. And I think, as was said earlier, the pandemic hasn't helped with what I think locality working was hoping to achieve for those across the office conversations. If people had managed to be located, together at least one day a week or something like that, and that sort of relationship building when you're sharing a hub within a community, I think that's been a shame, because you do tend to pick up on conversations and realise how you can support each other. So it'll be nice if that can be regained a little bit further down the line, once COVID issues improve. But yeah, we are always very supportive of a multi-agency approach because that's the only way to really address public health, address all those issues that affect someone's health and well-being. So we'd be very supportive of this sort of approach wider, really.
Thank you. Is there anybody who would like to ask a question of Katrina? Councillor Walker?
Sorry, Chair. I always look around to see if there's any other arms up first, but I seem to be the first. Katrina, thank you very much for that. I mean, I think it just goes to show actually how each one is dependent upon the other regarding multi-agency, because a family doesn't have, sometimes a family which has got troubles or has issues isn't just one area. It can be a couple of different areas that is affecting them. Could be, as you know, poverty, health issues. It could be the children who are running wild and taking advantage of maybe mum and dad who can't do as much as they could do before. And there's all these different things and facets to a family, as we all know, because we're all different. And I think trying to work with that on a one-dimensional basis isn't always easy. So I think this approach seems to be working well. And I hope that everything and the figures are going to stack up towards getting it rolled out. Do you think that's a possibility? And how do you think that will work as a public health? Because obviously you've only got so many officers in public health, and there's so many different things to be done with public health. I think it could be, it'd be onerous, and it could increase this. I mean, if it gets more people working for us, great. Hopefully we will, more jobs out there. So how do you feel that it would benefit other areas too?
Thank you, Councillor Walker. I think if I could maybe take an example, I presume lots of you are aware of the Live Well Centre and the concept that we have in Dundas House. And the staff that we had attached to two localities were actually motivators. So the Live Well Centre in Dundas Arcade was created, about 5 or 6 years ago now, on the principle that a person could walk into the Live Well Centre with multiple needs, speak to a motivator and have all those needs addressed either directly or through helping them to engage with relevant services or within the Live Well Centre itself. So there's various services in the Live Well Centre, from drug and alcohol to welfare rights to sexual health to, you know, mental health resources. And I think in a way we almost had a vision that perhaps the locality hubs could offer that. So somebody could come in through a social care link or through a housing link, and actually we could say as a locality team, we know exactly who you need to speak to help you with that. So I would like to see that, and I think perhaps if the pandemic hadn't happened, that would have been happening perhaps a little bit stronger. But that those opportunities are there, I think. But really, that doesn't mean that we just need more staff on the ground. It just means we need better links with the people who are already delivering it. So I don't think we'd love more public health staff. I don't think it's a case of we suddenly need a huge public health team, although that would be valuable. I think it's knowing who to speak to in the services that are already funded, whether it's VCS organisations, whether it's council services, whether it's national organisations. So it's just having that approach, and throwing more people into the system isn't always the answer. The answer is actually working better with the services that are there. So that is the strength behind it. And it's that making every contact count approach. And within public health, we have worked in partnership with Public Health England to create a Making Every Contact Count website. So you could go onto there under any topic and get the guidance on how you find out what that person's needs and signpost them appropriately. So it's that Making Every Contact Count approach that I think should be the strength behind locality working, because every contact you make, you should make sure that person's getting something out of it and that you've linked them in with your partners around that locality. So I don't think it's just throwing stuff at it. I think it's working differently. And just on my little soapbox about COVID, I think if COVID's taught us anything, it's that we can actually change the way we work to address a need that's, you know, we've had staff pulled in from all sorts of corners at the council and external, and we've all put down the usual barriers and worked together very well to address a need. And I think it's shown that we can do that probably more effectively than we thought we could have done before.
Thank you. Thank
Can
you,
I just
Katrina.
follow up on just one point there? When about staff, I mean, it would need maybe a locality manager in different areas. I would imagine something like that. That would be an extra staff member, because, or unless there's anybody who would be existing into that. So I think maybe that would be a small area, and I think it would actually help different areas to know that that person is there who would have, if not all the answers themselves, to be able to signpost, as you quite rightly said, to get those answers elsewhere. But it seems very efficient, and I'd like to see what the outcome is going to be from the pilot. So it'd be interesting to see the results from it. So thank you very much.
I think you're right there, Councillor Walcroft. I think you need somebody who is that coordinator for each area, because they will know that area's needs better.
Yes.
And each area is not going to be the same. So somebody needs to know what the gaps are in that area and pull in the relevant partners. So yeah, that's you definitely need a coordinator. And I think also from the two that we've got already, and any more that are created, they should all learn from each other. So let's lessons learned and things that have worked well. So, and then you're not sort of wasting your time trying something that perhaps hasn't worked elsewhere. There should be joint learning there that can, you know, get other areas up and running quite quickly, hopefully.
Lovely. Well, thank you very much. Thank you, Chair.
Can I bring Sue in next, please? And then Councillor Udin.
Thank you, Chair. Just from an officer point of view, I'm just wondering, I mean, if members would need to probably know a little bit more about impact. So we know that these projects have been running for a while now, and we know that COVID has obviously changed the way that we've had to work. But it's also about, I think, you know, the so what. So we've had these two projects running, and, you know, it's been nice. And I'm sorry, I don't mean that in any way disrespectfully. I'm just trying to, you know, it's been good. People have been working together, but actually, has it made any difference? And how do we know that it's made difference? Now, I've got some colleagues on the call here that I've not met before, so I'm finding this really, really useful. But perhaps members will want to know, you know, and I know has got some statistics. So, for example, when we're talking about breastfeeding, has it increased in Newport and North Ormsby? Has it made a difference? So maybe we should be, I mean, and I certainly will take this on board in terms of my presentations about locality working. It's that so what question, isn't it?
It is, absolutely, yes. And I think that there is obviously quarterly data there. Obviously, we have Adam might want to come in here, but obviously they have different themes in their actual action plans and the data that they pull together. I think we have 3 or 4 measures around breastfeeding rates and teenage pregnancies, which is a difficult one to put in because it goes from 2 years. It's not an easy one to measure. But I know from our section that there have been improvements in those data. I'm not sure whether Adam wants to comment on whether that data gets shared wider on all the different themes that they gather and they measure on. I'm not sure whether he wants to step in. I'm only obviously aware of the healthy population bits that we contribute towards.
Yeah, I mean, yeah, absolutely, I will. What I can say is we've got sort of a full performance management framework for both localities. It includes 70 measures that we sort of use to plot improvements and or areas of concern, etc. So there's 9 or 10 sort of central figures that we use to look at the overarching aims of the project, and then there's additional data that we use around it as well. So that'll form it forms updates on a monthly basis through the sort of our strategic guidance group and things like that. But it will form part of the pilot report as well. So the information will be included.
Right, thank you for that, Adam. Councillor Woodin?
Thank you, Chair. Thanks very much. Yeah, Katrina, that's brilliant, actually. Obviously, your talk, fantastic, and sounds really, really good. I just wondered, obviously, I know we're talking about the children's services. Do you cover the adult as well, like all ages in the area through your journey?
Yes, public health from cradle to the grave is a public health expression, which isn't, not sure how people receive that word. The cradle to the grave. So yes, all ages. So even before the child's born, postnatal help and things like that, prenatal help. Yeah, so we cover all ages, all families, all communities. The full spectrum of health and well-being for all ages. Obviously, this one specifically around children. So, but yeah, any family member we try and support, an individual, vulnerable. Basically, public health is very much focused on vulnerable people, which can be anybody.
Yeah, that's great. Thank you very much. Thank you.
Thank you.
Thank you.
Anybody else? Right, can we move on now? And could we invite Stacey Carlisle to come in now from Newport Primary School to give an update from her?
Hi, yeah, thank you for inviting me to the meeting. I'm the Deputy Head at Newport Primary School. So obviously for us, we're certainly not drivers within the locality project. It's more about how the services who we work with to support our children and their families have changed their delivery model, I guess. So 2 main things really I would talk about. So first of all, early help. Having the senior practitioner who's allocated to Newport, we've seen that that's been very positive for us. She's very hands-on. She knows the families now very well. It means she can come in, we know her, she knows our families, we can have meetings on the same days, she can come in and pop in and see a number of children. She's working with a range of agencies, so when we're in meetings and the families are talking about issues with housing or with neighbours which are causing issues for the children or for themselves, she can work straight away with those teams and she knows exactly who she's speaking to. So that's been really positive for us, really having really strong practitioners who are really driving things forward and very hands-on. Communication has been really good. That's been very positive. The only thing is, from our point of view, is obviously we have quite a lot of families working with early help, so she just cannot have that caseload on her own. So whilst she has the majority of our families, there are families obviously coming through who are having to be allocated to other practitioners. Because there's only so many families that she can support. That said, all of the practitioners who we have been working with are also, very professional and working in much the same way. So we've been very impressed with early help and early help support. And the neighbourhood safety teams made a big difference for us, because a lot of time when our families, when they come to speak to us, it's about issues that are impacting on the family, but are not directly linked to education. So it could be that they're having difficulties at home, and that's the housing conditions are not good, or the children are not sleeping because of neighbours and noise, or the things that children are witnessing at home. So now when families come to us and they raise those concerns, whereas previously we would have been trying to look at who can support with that, who do we need to go to. Now I know I can drop an email to Adam or a member of Adam's team and just say, we've got this issue, is this something you can support with, or can you direct me? So we're not having to spend a lot of our time trying to get support for the families. And we know that when we're approaching the neighbourhood safety team for support, that's been acted on really, really quickly. And then we can reassure our families that's picked up, and we can concentrate on our role, which is education. And the same with the landlord licensing as well. We've had parents who the similar issues, and we've been able to go straight to the landlord licensing and say, can you liaise with the family? So we're not picking up as many of those issues which we know we need to support the families with, but it's not really our area of expertise as such. So those are the most positive changes for us, I think, within this model and the project.
Thank you. Do we have any questions? Thank you. I'm so pleased that this locality working is being assistance to the school and that you know exactly where to go to for the necessary help. I'm really, really pleased about that. It's really good to hear that that's for our children, because working, if a parent has a problem, the child has it as well. And it's fabulous that you're able to know where to go. Thank you for that. Anybody else like to ask anything? Councillor Higgins?
Thanks, Chair. I'd just like to thank the last speaker, because I've been banging on about early intervention for long enough. And I'm really, really pleased it's actually taking place. And it is helping the children. I know Sue and her team were very, very keen to get that up and running as soon as possible when she first came. So I'm really, I'm glad I came to the meeting, even if it's just to hear that. So thank you very much.
Thank you. Councillor Halawi?
Thank you, Chair. I think today, listening to all the different multi-agencies giving their contributions and working closely together highlights how our communities and our schools and our children, it's a holistic approach that we need to all of the concerns. And just to echo the sort of things that Stacey was saying right now about the school, there are so many problems outside the immediate education framework which impact on our children and indeed on the adults in our community. And sometimes they just don't know where to turn for help because there are so many multifaceted problems that they face. I think personally, the basic underlying problem that most of our families face in the community, the basic problem is poverty. They are faced with poverty, which impacts on their daily lives in so many ways. And some of them we've heard: public health, education, whether it's fly tipping, antisocial behaviour. And the fact that we have a locality model, I think, really helps us realise how we need to deal with our individual people in the society, our children, our community, in a holistic manner. And this locality model absolutely does that. And I also think it makes us realise that without a locality holistic model working, we can't help people by doing bits and pieces for them here and there. It just deals with a bit of their lives' problems. We need to totally focus on the whole person and the whole issues in the whole area to make things work properly. And on my personal experience in being involved with the locality working, I honestly feel really positive about the process, about the measures that we take to look at how the improvements are made, to pick on Sue's so what question. There are so many ways we can see already. Is that not the case, Adam? I mean, you and I speak about it regularly, and we speak with residents about how the impact of this model is making people's lives better, from the residents to the schools, to the health outcomes, to the police involvement, to the antisocial behaviour. So I only want to say a huge thanks to the locality team and everyone involved, and hopefully this pilot will progress and will extend, because I can't imagine living in Newport now without the locality model helping and underpinning all the good practice that comes from working together.
Thank you, Councillor Halawi. Any more questions? Stacey? No? Right, can we move on to Steve? Sergeant Steve? I'm sorry, I forgot your surname.
Hello, Patterson, Steve Patterson.
Oh, sorry, Steve.
It's all right.
Welcome.
Thank you.
Can
Good.
you explain to us how the locality works for you?
We've obviously been through difficult time with COVID, as people have said. I've been working with Adam, Mel, Mike, Louise over a range of issues, a lot around housing. We've put together weeks of action, days of action. We've worked more closely than I think we have for a long time. From when I started on neighbourhoods a couple of years ago, 2 years ago, we just didn't have any staff. We had no one covering really, not Newport. We were pulled and pushed all over the place. And that's starting to come together now. We're starting to get a few more staff. Hopefully in the new year, we're going to get a few more. So we can push through and make the locality working more stronger. By working with more of the agencies, hopefully, fingers crossed, we aren't going to go into more lockdowns and working from homes, because that just seems to make everything stagnate, unfortunately, which is fair enough. If you're told you have to work from home and you can't come out, then there's not a great deal we can do. And obviously we've got obviously lots of issues going on in Newport. My team covers Newport solely. But what we're hoping to do, and what we've done over the last few months with our engagement, is working specifically with the kids. Got PCSO Debbie McClelland, who's absolutely brilliant with a job. She has engaged with the kids at the hub. We went down there last week and had a kick around with them. We do the Middlesbrough Foundation kicks with the kids. There's a lot of things that we do. Obviously, that's on our engagement and trying to speak to them, and build bridges with them and make sure that they know who we are. Only from one session of football with them, and they're coming up and saying, "Oh, my mate was saying this about you, my mate was saying that, but you're all right, really." And you think, if you just, that's in 1 week, and it is obviously beneficial for everyone if we do that. If you go into the more, where there's actually sort of more serious crime, there's obviously there's OCGs that work in throughout Gresham. We've got to work with them. They obviously employ kids to run illegal substances around the place, as we know. Trying to break into that, trying to stop any issues that come from that. It's all made a lot easier when you know who you can turn to. Now, I'll admit that I was obviously concerned about this meeting. I didn't really know enough to talk to you, but it boils down to fairly basics. If I know I can pick the phone up and speak to Adam, speak to Louise, speak to Mel, they'll know someone who can help us. And I think before we did work in silos, we were decimated, so that obviously didn't help with staffing. But on a positive side, and to sort of put that in the past, we've got links to these areas now that you would have probably found quite difficult to find these people. So the locality is working really well. We've got a couple of action plans that we have meetings regularly with Adam. And I mean, it's all about building bridges. It's all about making professional relationships with people. And if they need our help and we need their help, we've got somewhere to turn to. So it does work. It is working well. It's just a pity that this pesky COVID seems to just keep spoiling everything, unfortunately.
Right, thank you. Thank you for that. I'm glad to hear that you feel it's working. That's what we wanted to hear. Does anybody want to ask Steve any questions? Councillor Walker?
Is that a no?
Thank you. Only me. Thank you very much. Thank you, Chair. Yes, Sergeant Patterson.
Thank you.
So you find it works, and you find it's going to be it's quite effective. Do you find that now with your officers that you've got available to you, that's your PCSOs, I would imagine, and also your police officers, that you've got you're getting more intelligence from the communities and more trust and building up those better relationships with people, as opposed to not working with everybody and working, as you quite rightly put it, in the old-fashioned term silos, where everybody worked and did their thing, but nobody knew what the other person was doing. Do you think that that is the best way forward for many ways of working with the communities as well that you serve?
Yeah, of course. I mean,
I didn't know whether I messed my questions up then for you, but I do try.
no, I mean, it's almost like it's not rocket science, is it? If you've got people telling you, you know, the pertinent thing. I mean, not just telling you absolutely everything that's going on, because we can't unfortunately do everything. But we went slightly off, but we went to the park run the other couple of Saturdays ago, and there was an old he was going off. There's an old fellow who came up and was talking to us, and he just wanted to vent a little bit. He just wanted to talk to us, and he was giving us little bits of information about antisocial behaviour, excuse me, going on. And it wasn't a great deal we could do about it. But you can then say, right, well, I tell you what, next Saturday, we'll have a mooch over there. We'll go and see. You might be lucky, you might find someone, you might not, you know. But for him, excuse me, for him, he'd managed to talk to a police officer. It's the same with for example, Adam. You know, if we see something going on and it's not a police matter, you know, pick the phone up and speak to Adam. Adam will know someone and he can get it sorted. And then you can go back to that resident and say, oh, we've brought him to the council for you. He's going to get it sorted out. And they think, brilliant. The next time somebody sees something, they'll pull you and say, they might give you a little bit more information. So yeah, it is all. I mean, I've spoken to Mike Whitehead today. I've spoken to Adam earlier on, all talking about the same things, bits of information. If it wasn't for one of the council members getting in touch with us and ringing us, there would be quite a serious crime without a suspect at the moment. But he knows that he can ring us on that phone, and you know, if we're in, we'll answer it. And you know, he's got the confidence that something may happen, or it'll go somewhere where someone will listen. So yeah, I mean, the more the merrier, really. I mean, we've got to work together. And I think when we do work together, you do see a massive improvement. I mean, they're only talking about the crime figures and that for last October with Adam earlier, and they are going down. Why is that? Is that because us and the council are closing more houses and getting rid of troubled tenants who just drag in loads of antisocial behaviour, crime, disorder? You know, everything that gets reported, is that the case? Are they actually starting to turn a corner in Newport? And if we do start getting rid of those problems which are taking up most of our time, suddenly it opens up to being, well, actually we can start dealing with the more minor stuff. And I think a lot of the time it is going back to that sort of little bit of zero tolerance, where you start picking up on these things, and you can start improving things, like, you know, like the things that a lot of people don't go on about. Oh, I'm afraid I'm going to get seriously assaulted, but I'll worry about my car getting broken into. I'll worry about litter, or I'll worry about, you know, people hanging around. We can start looking at those things if we can get rid of a few of the major problems, and working with the council is only going to achieve that.
Yeah, good. I just want it in Hemlington now, so that's all I'm going to say.
Hemlington,
so
yes.
Thank you for that. Thanks very much. Thank you, Chair, for your patience. Thank you.
Thank you. Thank you for that. Is there any more questions? I'm just so pleased that you feel working together like this from our locality working is actually working, and I'm so pleased to hear that. Councillor Undo, yeah, Udin, sorry, Councillor Udin, would you like to come in?
Yes, thanks, Chair. Thank you. Yeah, Steve, thank you very much for your talk. Obviously, yeah, it's fantastic. Yeah, I just wonder, you know, with the young children, I know, sadly, obviously, the lot of people's view of the Newport, you know, for the young people, it's a problem area. And how do you find these young people contribute? You know, like, so they're working with you, and how do you think yourself, you know, working well with the young people mainly in the ward?
The young people, Deb McClelland has been brilliant with the kids. I mean, the young kids, she's known when their mums and dads were young kids. You know, she's got that. You can't buy what links she's got with some of the families. She's got, you know, nearly 2 decades of working with them. And for those, and knowing Deb, it's a big in. there's a lot of new communities that have grown up. So trying to engage with them, there's obviously, say, language barriers, you know, just the whole perception of how the police are seen in other countries, and then you sort of go up and say hello, and there might be a little bit, some people might be a little bit cagey, a little bit, you know, like that's not what happens in the country they've come from, so therefore they're a bit scared. You've just got to break them boundaries down. There's a lot of young kids who are thinking they're little gangsters. They just will not respect the police or anybody. You're always going to get that. You're always going to get those kids. But a lot of the time, when you get, you know, one of them on their own, or, you know, a couple of them, and you see you go to the youth club, or they realise that you're not, you know, you're not everything that some people say about you. You know, it's I think it's not just Newport, it's everywhere, isn't it, with young people. And I think that, you know, the earlier you can get them, if you can go into the Newport school, we try and do Operation Roachford as much as we can, which is where we'll go to the schools and on a morning when the, you know, the parents are all turned up, and it's sort of under the disguise of a traffic sort of operation, make sure they're not parking on crossings and little bits and bobs like that. But, you know, last week they were having snowball fights with the police officers who were there, and someone wrote in and said, you know, it was really good for the kids. And you think, you know, if you're getting them at like, you know, really young age, it's brilliant. It's just keeping it. It's keeping the teams. It's keeping the impetus on. You know, it's getting our our bosses to understand the importance of what neighbourhoods, you know, do. And it isn't just a lot of quick fixes, quick hits. It's years, you know, and it's working with these kids for a long time to grow up with them, you know, and that's what we need to be doing, not just being in and out and, you know, it's sort of a 2-minute job.
Right, thank you.
Thanks,
Just
David, thank you. Thanks for that.
One thing I would like to ask you is, you're talking about PCSO who's worked in the area for many years. Does she work at the hub, or does she go to the hub?
Yeah, all the time. Debs is a unique character, a unique employee. She's absolutely brilliant. She's everywhere. She does the collection of over the last few months with a load of toys for the kids for Christmas, wraps them all up, or goes to the homeless cafe, goes to the Euro Caf. She's absolutely everywhere. I mean, she is everywhere. Deservedly was recognised earlier in the year with a medal from the Queen. So she is excellent. And, you know, it's what PCSOs should be doing. They should be going out and engaging with people and walking the streets and chatting and going into shops and going into the hub and just engaging with everyone, being involved and being everywhere. The PC is obviously a little bit of a different role, but that's what you'd expect from the PCs. They have to be a little bit different. But, you know, that we have got PCSOs for Gresham, solely for Gresham, and yeah, they're there as much as they can be.
Right, thank you. Councillor Halawi?
Thank you, Chair. I suppose one of the downsides and upsides of the excellent provision is that it highlights problems as well as resolves them. So, for example, to go back to children and young people's social care and pick up on what Stacey was talking about in Newport School, we do therefore find in looking at the problem of taking care of the locality that more and more problems emerge, and that's by dint of being effective in our working practice. And therefore, there's going to be a continuous a challenge of finding enough staff, as Stacey alluded to. You know, that with the early help, we find that there are more and more families needing early help through the work that's happening. And that's the challenge, that we find more families and we need more staff. And I think that's proof of the good work, but it's also the challenge, isn't it, moving forward with having enough provision out there to deal with all the cases that are thrown up to us by dint of the investigations, of the discussions, and all the other practice that's out there. So my question is, you know, do you think that we have capacity to expand even within Newport? And I definitely take the point that Jeanette made about it'd be marvellous if we could have a locality working in Hemlington and in other areas. But even in one area, the more work you do, the more work you realise that there is yet to be done.
Yeah, no, that's absolutely true. But if it's there, isn't it? And it just the fact that you realise it, you know, is.
It's good, isn't it? But it's a challenge as well. How do we deal with
Yeah,
what capacity?
I suppose you've got to look at what you know, like you said earlier. A lot of the issue is poverty. A lot of the issue
poverty, yeah.
Education, you know, and unfortunately at the moment it's I don't know what we're going to do to get out of, you know, to raise people finances up. I mean, it's a bigger problem than you or I. But you do see people and they don't have anything. But you've got to then be able to say, right, well, I know that this is like another person, another case and that, but maybe you've got to look conversely and say, well, thank God it's another person we've managed to work with. You know, Adam sends emails out to me all the time, loads of other people with loads and loads of events on and things to help I would never have known about. And you never know, and I send it to my staff and you just don't know, but one of them might look at it and go, I do know someone who might benefit from that. And if they bring two people along with them, then that's a good thing, isn't it? But we can do what we can do at the moment. If we keep scratching the surface and it's getting worse and worse, then obviously that's look at that a little bit differently, but a little bit too much for me, that.
Right, thank you very much, Stephen. Sue, you wanted to come in?
Thank you, Chair. Thank you, Sergeant. I think that was really, really helpful and very, actually very thought-provoking. I think I agree with Councillor Halawi, really. The resources we've got are the resources we've got, and we have to use them in absolutely the right way. And locality working, this pilot project, is one of the ways that looking at how we can, you know, do more with less or do more with the same, I think. I think also, though, we need to know, you know, we need to get to the evaluation of the project and look at that so what question. And it's sounding like there's a lot of so what, but we need to be very precise about what that so what is. But also, if we're to roll it out, it's going to look different in every area. We can't have, well, I don't think we can have a hub like we've got, locality working like we've got in Newport and North Ormsby, in every area of Middlesbrough. It'll look different because there'll be different issues. It may be that some wards need to be combined. I'm talking slightly off the top of my head because I don't know what it will look like, but I think it is about looking at the needs. And certainly in children's services, there's been a lot of analysis of need, and Newport and North Ormsby come out high, you know. But I would also agree that that shift towards early help and that preventative and that joining up is absolutely where we need to be. So I'm trying to celebrate what we've got now, look at what we've got to progress things further, but acknowledge that it might look very different in other areas going forward. Thank you, Chair.
Thank you, Sue. I totally agree with what you're saying there. We've got to work with what we've got now. And I think the two pilot schemes are working really well. And I do agree that if it went to different areas, every area is different. And so we'd have to look upon it and in a different way on how it would work. Is there anybody else who'd like to add anything? No, I'd like to thank everybody for coming this afternoon to this meeting. It's been really, really, really good, and we've learned a lot from it. I hope Joanne's got lots of notes she's made. I'm quite sure she will have. And I want to thank you all for coming this afternoon. Thank you. Can we move on with the meeting now, please? Thank you. We'll go to agenda. You can all stay if you want to, but you can also go if you've got other things you want to do. Thank you. We'll go on to agenda item number 5, which is our COVID update. Sue, that's you, I believe.
Thank you, Chair. Obviously, in terms of the Prime Minister's announcement yesterday, people will have heard that. In terms of children's services, everybody again is working from home, although we hadn't really got back into the office in the way that you know, we were returning back into the office on the sort of 40-60 split from the 6th of December. Obviously, that's been put back to some extent. For social workers, really, it's business as usual, carrying on as we would, but carrying on as carefully and as confidently as we possibly can. In terms of schools, our Director of Education, Rob Brown, has met with head teachers this morning. I mean, obviously, there is some concern around schools. There's particularly been concern around, things like nativities. Some schools are doing different to other schools. For some, so there has been, as Rob said to me this morning, some confusion around parents because some nativities, for example, are going ahead and some nativities aren't going ahead. And why would it be different in school to school? I think there are reasons for that. So, for example, the availability of staff is one, but also, where do you look at, and where do you, what am I trying to say? How careful do you need to be in the particular area that you're in? So, really, it's about schools probably having a reset. We've got a fire break, as it were, coming through with Christmas, with schools being off for a couple of weeks. I think generally the message from Rob is that let's see where we get to in January. Let's see where the schools are in January. January is a time when parents, for example, there are less events, less parties, less Christmas lunches. So it will be back to a sort of more steady state. So it is generally looking at the situation where we are in January in terms of infection and a quieter time generally in schools. So that in a nutshell is a very quick update, but I think it's, as with locality working that we've just been talking about, it is watch this space.
Yes, I totally agree with you. I think what I've seen locally, our local school, is that the parents are now wearing masks when they take the children to school.
Yeah, absolutely right.
I'm pleased to see that. I don't know whether we instigated that as a council and asked the schools to ask the parents to wear masks, but I know they weren't, but I have seen this week that they are now. So
the general message is that, sorry, Chair, the general message would be that we would be encouraging, well, schools will be saying to their parents individually that they should be wearing masks, but we would certainly very much be encouraging that.
Thank you. Thank you for that, Sue. Is there anybody like to ask Sue anything on our COVID update? No? Thank you. I'll take that as a no. We'll go on to agenda item number 6. Oh, sorry, Councillor Halawi,
okay.
sorry.
I just wanted to pick up on what Sue Butcher said just now. I raised it this morning at the Children and Young People's Learning Scrutiny panel about the complexity of some schools having nativities, etc., and some not. And obviously I take your point, Sue, about staffing in schools, but I know of an area in the town where one school on one side of the road is having all the nativity and all the full-blown Christmas celebrations, and the school literally over the road in the same community has closed it all down, and hopefully we'll be putting it on the media process, etc. And I just think that causes consternations in the heart of our community, and it's one school over the road from the other. And I take it there might be staffing issues, but I just wish that as a local authority we could give some advice overall to schools to say, given the situation that we're anticipating or that might be happening or whatever, we would recommend that you all basically do the same thing, whatever circumstances it is, in this case nativities. And I'm the last one to say don't have nativities, because I acknowledge the benefits that they give to our children. But I just don't want to see one group of people in the same community, looking at the ones over the road and saying that's not fair and that's not good for community cohesion across the town. So it was just to make a plea that the local authority might be able to preempt some of these problems by making some statements that encourage schools to work in the same way, given whatever problems we face. And this is an example.
I think it's really challenging, Councillor Halawi, because with most schools we only have influence and nudge.
I know. Oh no, I acknowledge that.
We can't say to them,
that.
And we can give general guidance. And I know that Rob, in talking to head teachers, is very measured about what he says, and very, and very realistic about the risks and how to handle them and how to advise. But if certainly, academies choose not to, then I think, for example, then it is very challenging. But we have a good relationship with our schools, and we would certainly want consistency.
Yes, that's what I'm asking for, really. That we could please make a plea for consistency.
We can only say it. We can't
Yes,
make
absolutely.
it.
Yeah,
Thank you.
yeah, I totally agree with what Councillor Alawi said, because I know some schools have had the nativity play and people have attended, and other schools they've just recorded it for the parents, and it's a shame that that rule wasn't for everybody. But then, it's, as Sue's just said, it's up to the school to decide what they want to do. Councillor Walker, you wanted to come in?
Yeah, thank you very much, Chair. Yes, I think it's sad that this has happened, unfortunately. I think it's divided communities over this as well, because I know that I've got two schools near me that are quite close to each other, and you see one is doing something and another one isn't. And you quite, I mean, yourself, you see some parents at your school, maybe local school, wearing masks, but I must admit, I haven't seen many wearing them in my area. So it's a bit of a shame, and I think that's what's happening. I'm going to say it, I don't want to be political, but I do think that the government needs to sort out and say exactly what it needs to say, because we cannot leave this to communities and to local government to actually try and sort out what needs to be said, because this is an emergency now. It's becoming more serious as each day passes. If things are happening within 3 days, that these figures are changing so quickly, and I don't think people understand or can actually comprehend how quickly things are moving at the moment. And I think we've got to help, and the government has got to help, and everybody has to try and sort something out to give people more guidance and advice as quickly as possible to help people over that, because people are very muddled to everything at the moment and are unsure and can very confused. And I think we need to be the big boys here. We need to sort things out and help. And if we can't do that, then we're failing them. So I think I agree with everything that's been said so far. Councillor Lowy quite rightly has brought it to the fore, and I think it needs to be discussed. And I do think we need to actually urgently get this advice and guidance out there to the schools and ask that they sign up to it, because they're all part of our communities and they're the people we serve. So thank you very much for giving me that opportunity, Chair. Thank you.
You're welcome, Councillor. Did you want to come back on that, Sue?
I think I absolutely acknowledge what both Councillor Halawi and Councillor Walker have said, and I certainly will talk to Rob about whether there's any strengthening advice or anything that we can do that might influence it. I'm not sure that there is, I'll be absolutely honest with you, and we are drawing towards the end of the school term anyway. I think it might be that we have more clarity in January, or we try with that clarity for January. But certainly I will have a discussion with Rob about if there's anything we can pick up now. But I accept and agree with what you're saying. Thank you.
Right, thank you, Sue. Right, we'll move on now to agenda item number 6, which is the Overview and Scrutiny Board meeting, which was held on the 7th of December. The Executive Forward Work Plan programme was looked at. Update from the Deputy Mayor and Executive Member for Cultures and Communities. Chief Executive update. Scrutiny Panels Chairs updates. Revenue and Capital Budget Project Outturn Position Quarter 2 21-22 discussed, and the next OSB meeting is on Tuesday the 18th of January at 10 a.m. Our next meeting, sorry, Councillor Halawi?
Yes, thanks. I just want to refer back to a comment I made in the Overview and Scrutiny Board when we had the update from the Executive Member, Deputy Mayor, about communities in culture. When she described her portfolio to us and the different activities that were happening across the town, events and such, I think she thought that related to culture, which it could do. And when she referred to community, she talked about hubs and the building of new community venues in the place of the Southland Centre and in Nunthorpe. However, for me, as I said then, and I'm just repeating it now, because I make a plea, if we're talking about communities, essentially for me, that means talking about people and the people who live within the boundaries of our community, whether it be our wards, our town. And I want to find out what's going on exactly within our communities, what groups there are, what activities there are, what diverse communities we have, how they operate, how they learn, how they live together, work together. And I'm a bit less interested in the buildings, community buildings. I'm interested in people. And I really want to find out as much as I possibly can about the people in my ward, in my town. And it's a hope that from now on, I can find that out from the executive members who have responsibility to talk to us about communities. Thank you.
Yeah, can I just suggest to you, Councillor Hawawi, that you contact Councillor Smiles and put this point to her?
Yes, I have done that, but I just wondered if everybody else felt the same as I do, that communities means people and people who live within a certain area. Thank you.
Thank you for that. Our next meeting is on the
Sorry,
25th
Chair,
of January.
Can I just come in a minute,
Yes,
Chair?
Councillor Higgins, yes, of course.
Yes, I agree with Councillor Halawi. Executive members should talk about the whole of the town and not concentrate on their little bits, because that's just wrong, I think. They should say what's happening across the town and not just their little patches. So I hope that letter to Councillor Smiles does some good. So thank you, Councillor Halawi, and thank you, Chair.
Would you like to also contact Councillor Smiles and put this to her, Councillor Higgins?
Well, I can't really, because I'm not on that committee and I wasn't there.
Right, okay, thank you.
Yeah.
Anyway, thank you for your comment.
Well, if people support my idea, that's all I'm saying. I will contact Councillor Smiles again and ask that we all get an update. Really, I suppose what will happen, in fact, is that we will get an update on our communities through the executive reports that will go to full council in January. I think that's where we will get an update. But my plea was to please help us find out about the communities across our town, the people who live and work there, and let's hope, therefore, that we will see that. I think that's right. Can I ask Caroline? I think Caroline would agree that that's where that information will come through, isn't it? In the executive report in January.
Right, thank you. Thank you for that. Well, we don't have another meeting before Christmas, so I want to wish everybody a very Merry Christmas, and let's hope 2022 we can all meet in council to have our proper meetings. I don't know when that'll be, but I'd like to wish you all a very Merry Christmas. And Councillor Awawi, would you like to come in?
I just wanted to wish all the very best of luck to the children's services in the next few days.
Yes,
I think we all know
totally
what I'm talking
agree
about.
with
I'm
you
not
on
saying
that
anything, any words, but I think we're all behind you and we're thinking of you and we're sending you our very best wishes. We know that you'll be excellent, but it's just to know our warmest thoughts are with you over the next few days. Thank you. As well as a very happy Christmas, everyone. Sorry, Chair,
Yes.
I wasn't taking away from it, but that seems the immediate thing is the next few days, and then we've got Christmas in the next.
It is. I totally agree.
Thank you.
Thank you for that, Councillor. So, anybody else would like to say anything? No. Our next meeting is the 25th of January at 4 p.m. Thank you all very much for your attendance. Joe, could you just stay online for me, please? Thank you.
Bye.
Bye.
Christmas, everybody.
All the best, everyone. Thank you. Bye-bye.
Happy Christmas.